Great. Thanks, Kate. So here's our agenda. So welcome. We are going to start with a presentation from Bobby Jo Halton, who is with 211 Alberta. And then we'll be looking at resources and FYIs, and Deanna Cretu will give us a bit more information about the Imagine Institute for Learning and their mental health first aid supporting older adults free training there. Okay, I'm going to stop sharing and hand it over to Bobby Jo.
Good morning. So as mentioned, my name is Bobby Jo Halton. I work for 211 Alberta. I'm actually situated at United Way Capital Region, which is in Edmonton. So 211 Alberta is actually a partnership of 3 organizations: us, United Way, Canadian Mental Health, and also Calgary Distress Center. So the three organizations, sorry, together make up 211. So my role is called Community Engagement Manager or Portfolio Manager, something like that. So I've been hired to try to help 211 kind of have a little bit more, say, and a little bit more pull and a little bit more resources and more of Alberta, because most of our resources and whatnot are kind of more in Edmonton and Calgary and some of the larger centers. So hopefully in my new role, I'm brand new, I'll be able to kind of have more depth to what we provide. So before I can carry on and maybe answer some questions and give you a bit more information, I'm just going to show a quick video. I had actually started doing a whole slide deck, and then I realized this video existed, and I thought, why would I, first of all, reinvent the wheel and also yammer on, because I don't know if you can tell, but I'm very nervous, when I can just put it in a video. They can say it all, and I don't have to worry about embarrassing myself. So I'm going to play that for you now.
Two-on-one empowers communities across Alberta by connecting individuals with the supports and services they need right when they need them the most. Every day, each of us depends on services that we don't think about. Our electricity, water, and internet systems are just there, reliably springing into action at the touch of a switch or a tap. But what happens when your everyday life has gone wrong? Where's the button to push to connect you to the services you need when you're in a mental health crisis or don't have enough food for your family? Too often, individuals are left in the dark about these supports, stumbling their way into closed doors and dead ends. 211 works to shine a light on the resources available in every community in Alberta by plugging individuals into a network of supports. One call is all they need. Just like the power grid, every community in the province is part of a grid of resources. These can be housing supports, mental health services, employment assistance, food security programs, or others. While many people have need of these services every day, they often don't know how to find them or even where to begin looking. 211 makes the connection for them. 211 Alberta maintains nearly 35,000 listings in our database of community resources, so Albertans reaching us are connected to a full range of available supports, empowering Albertans to choose what supports fit best for them. In the last year, Albertans have connected with 211 nearly 400,000 times via online search, phone, text, and chat. On phone calls, 211 offers follow-ups to callers to check in with that person in a week to 10 days and find out whether they were able to get the help from the resources. We aim to offer follow-ups on 8 to 10% of our calls. In the last year, we offered nearly 74 follow-ups, which is 8% of calls. Of those, about 4,300 accepted the offer. So what did we hear? 87% said they know more about how to access community resources to meet their needs after speaking with 211. 82% said they know more about what community resources they are eligible for. 36% identify experiencing challenges accessing the resources. 98% said they were likely to recommend 211 to others. 211 is person-centered. When people are in distress, they aren't always able to navigate complicated chains of referral, and they can find themselves bouncing from agency to agency, being sent from worker to worker, and telling their stories again and again. This is time-consuming and demoralizing. 211 does the navigation for each user. Albertans can call, text, or chat online with us from anywhere in the province, 24 hours a day, 7 days a week, and know that they will connect to a real person who will help them find the services that they need with respect and care. Kate and her children were fleeing an abusive relationship when she called into 211 for addiction and counseling support. The 211 community resource specialist was able to connect Kate with several low-cost counseling options for herself and to child and adolescent mental health for her kid. She was also connected to outpatient services through addictions and mental health, as well as Alcoholics Anonymous. Before ending the call, the 211 specialist offered to follow up with Kate the following week to see how things were going. A week later, Kate shared that she had already started seeing an addictions counselor and was going to AA. And her kids were booked for their first appointment with a counselor the following week. We are a lot happier and feeling a lot stronger in our mental health. 211 has really saved our lives. So who uses 211? Like Kate, individuals seeking supports for themselves and their families. But we also have family, friends, coworkers, and other natural supports seeking assistance for someone they care about. Service providers seeking support for their clients. Many social workers call us near the end of the day, wrapping up case files and seeking resources they're not yet aware of. Community agencies seeking to connect their services to our network, for instance, in Edmonton, our Winter Emergency Response Plan, as well as planners and decision makers seeking reliable evidence and data on needs analysis, programs and interventions, use rates, or risk assessments. 211 Alberta empowers systems. Our data dashboards are publicly available on our website and provide information about the trends on 211 contacts and the needs of Albertans. 211 data can paint a picture of what's going on in community, informing policy and decision-making. We are on the ground connecting with individuals, but we can look at the data from those individual contacts, lift that up, and see what's happening in community from a bird's eye view and share that view with decision makers and policymakers. We are an evolving hub for Albertans. 211 Alberta is the only 211 service in Canada that is fully integrated with a 24-hour crisis service. Our staff and volunteers share training with crisis line workers. We are the only service that can provide a broad range of assessments across the spectrum of individual and community needs. Alberta is a leader in this work, putting us far ahead of other provinces in building out the infrastructure needed for a strong and responsive grid of supports. So when you include the texts, chats, and calls to those crisis services, that number reached from 211 becomes closer to 480,000. But we also support other lines in our community. For instance, people can call 211 for crisis diversion in Edmonton, as well as social diversion in Red Deer, the seniors information phone line in Edmonton, or when they have a concern about human trafficking, they can dial 211. Additional lines that our hub operators answer include the Family Violence Information Line and Bullying Helpline, the Seniors Abuse Helpline, Brightline, Connect Teen, Rural Distress Line, and 1-800-SUICIDE. We also offer after hours and overflow support to other lines in the province. So when we include all of those phone lines, we're actually reaching 524,116 connections from Albertans in 1 year. 211 Alberta is your partner. We partner with multiple stakeholders across the province, providing things like facilitated transfers and linking protocols with Kids Help Phone, Alberta Supports Contact Center, and Income Supports Contact Center. We are working on co-location planning with Calgary Police Service 911 and Edmonton Police Service Integrated Dispatch. We have data sharing work with Healthy Aging Alberta and municipalities. We are even working on shared assessments with SAGES. 211's province-wide network helps reduce duplication of services and improve the effectiveness and efficiency of existing resources. This means Albertans can be plugged into the grid of supports and light their way along the path to resilience and well-being. We are proud of the work that we do and of the thousands of Albertans whose care and support go into powering our system. We continue to seek opportunities to expand our navigation and crisis hub and to collaborate with key stakeholders in our province. When people do not know where to turn or how to start their journey, they and you can trust that every call to 211 will be the right call.
So that was my boss Stephanie's version of what to present, and that is much better than what I could have offered you guys. So just a few things I just wanted to kind of touch base on with you before I open up for questions. I wanted to just let you know that so 211 was funded to go province-wide until 2019. Of course, that was with the pandemic. So if, as you can imagine, we're actually still quite young. We're still kind of like in infancy when it comes to like getting together all the data and resources that would best serve the entire province. Although I feel like we're doing okay at that. Another thing I just wanted to touch base on was we answer all the lines. We do all the, they can call 211 and whatnot, but I think it's really important to know that another thing that what 211 does is it relieves pressures from other delivery systems such as emergency management, crisis response, police co-location, and income support. Sometimes when chatting with people, one of the questions is like, there's so many 111 lines. I never really know which one to call. Hopefully this will help some of you guys understand how 211 is different than some of the other lines, but particularly there seems to sometimes can be confusion or unsure around when to call 911 and when to call 211. And basically what I say, the rule of thumb there is that like, if a person is like not breathing, threatening violence, if there's violent behavior, something seems really unsafe or really emergent, then that's a 911 call, of course. But otherwise, it's a 211 call. Like if someone's sleeping in a lobby, intoxicated, dressed inappropriately, someone kind of looks a little unsafe, is confused or disoriented, that's probably going to be a 211 call. No matter what, if you've called 211 and it's not the right fit, 211 will definitely send you or connect you to the right people. The other thing I wanted to mention again was the database. Now, I'm not sure how many of you have been to the website. Really, to me, it's the most important for folks to know about. So I would suggest you, when you have a few minutes today, tomorrow, whenever you have some time, go to the website and check it out. Because that's where if you need resources, that's where you're going to get resources. And I just know when I was doing frontline social work, at the end of the day, or I'm looking at my case plan or whatever, and I'm kind of stumped, I often would use 211 as a resource. And I would call. Another thing I would do with clients on a weekend, or I knew I was going to be away, I'd be like, if all fails, here, take this card, call 211, and someone there can help you out. So I would suggest if you have a chance, go there and get familiar with it, because you also can print off resource sheets and whatnot. If another thing that we really ask folks to do is, if you know an organization or you're part of an organization that can be in our 211 database, please do that. So who can be in our bad database? Nonprofits, charities, educational institutions, most levels of government, social hubs. The only thing that we ask is that they've been kind of running for at least a year, just for consistency. If you do go to the website, you can actually on there recommend a listing, and that will help. And then our database team will reach out and sort out how to do that. And the reason why we really try to push this, and sometimes we're knocking on doors, is because really the more we bolster our database, the more resources we have across all of Alberta. Particularly, like I said a little bit earlier, we really want to bolster those in some of the smaller communities so that people's needs get met. I think that's all I feel like I need to say. I think it'd be a good time to open it up for questions, and I'll do my very best to answer them. Like I said, I'm relatively new to this position. I love question time because then it reminds me what I need to go and find out if I don't have the answer. So yeah, go ahead. I think I see Sandy.
Hi, thank you for that information. So we have noticed that over the time we have multiple listings in 211 for our FCSS program here in Innisfail. And so I'm just wondering, how do we get rid of all of those and start fresh with a brand new one?
Yes. Oh, FCSS often have this issue, and it's something we're really, really trying to sort out. And we appreciate any help that anybody can have. Yeah, if I'm just gonna get, if you could email the database team, they would love to hear from you.
Hey.
It's database@ab.211.ca. I can even give you a phone number. 780-392-8722.
Okay, can you just repeat the @ab.211?
.ca.
Perfect, thank you.
Yeah, FCSS have a real issue here because it's like I said, so when we went province-wide, it was during the pandemic, and then it was the wildfires. So we basically were just like, right? Like, and there was no structure, like there was some structure. I don't want to minimize it, but definitely now that things have kind of calmed down, we're having to do some back playing and sort some of that out. Cause like, yeah. So thank you for bringing that. That's a great question.
Awesome. Thank you so much.
Can you just give that phone number again?
Sure. 780-392-8722.
Great. We'll put that. Oh, there we go. Thank you, Kate. We just have a question from Pam about how does this integrate with 811? So that's the Alberta Health Services Health Line. And then also part of what happens through that is people are able to be referred to a dementia support line through there.
Right. So again, if someone was to call 211 related to so 811 and the dementia, all of that would be one of the resources that we would refer to. So some of these referrals are going to be what we call warm handoff, right? So it's going to be like, let me get someone on the line for you who can help you with that, right? Because 211 is navigating a lot of different lines, we get a lot of different calls about everything. So they have a process that they follow, trying to do the warm handoff to the right line or to the right people. Yeah.
Okay. Great. So then we have another question from Erin, just wondering if she heard correctly that the 211 seniors line is only available in Edmonton. Is that right?
Yes.
Okay.
Correct.
Okay. And then oh, I see Indy. Yeah, go ahead, Indy, and then we'll get back to the chat box, but go ahead.
Hi, thank you so much for this presentation. It was very informative. I just have I was wondering, because I'm in the home care sector, and I often hear when we go into homes that the seniors are struggling with getting home care, reaching out to the continuing care access number because they don't know how to go about it and stuff. So we do provide like free in-home consults. So would that be something that we can do something on 211 to help these people?
Like, do you mean, could you tell them to call 211? Is that what you're asking about that?
No, they call 211. No, I'm just asking, like, do you get people calling you for, oh, where do I go from home care? Like, I don't know how to do this. And do you get those calls? Okay.
We do.
So do you guys, how does the process work? Do you guys give them the access number or?
Yeah, honestly, that's a frontline worker who would answer that call, not me. And they do have a process. And so if it felt like it was the right fit, that's definitely what they would do. Sometimes, like I actually was just listening to a call recently with a senior, and sometimes they have to whittle it down and find out that the need that they're calling for sometimes is different than what they originally started calling for, or they're looking for the wrong information or whatever. But they definitely will, if that is what feels like the right referral to the person answering the phone, that's what they would do.
Okay, thank you.
Great. Okay, we just have a couple more questions. Oh, sorry, Kathy, I see your hand there. You go first and then I'll go to the chat box. Thanks.
Okay, awesome, thanks. I just wanted a little bit more clarification around the senior services only being in Edmonton. So if a senior from Cold Lake called the 211 number, would they be provided with information in Cold Lake?
Yes, if we have information in our database.
Okay.
So just so you know, this is something that's really exciting. Because we know that there's lacking resources and services in smaller parts, or communities and remote and reserved places, we just hired 4 community engagement specialists. One in Grand Prairie, one in Lac La Biche, one in Lethbridge, and one in Red Deer. And we're going to be dividing up the region so that these people, their jobs solely will be to bolster the database, build relationships so that we have more resources for small towns when they call in and there seems to be a lack. So if there's a lack in that area of like at least information, we hopefully will in the next little while start working on that. If there's a lack of actual resource in the area, there's not much we can do about that except offer the best thing, right?
So Bobby, Joe, I know we have a number of people on the meeting here and connected to us. And this is basically what Lisa's just put in there, but how do these folks connect with those individuals? Because the folks on this meeting and connected to it they've got that information in those rural and remote communities.
Right, okay. So we just hired them. This is brand new. Like they just start training on July 4th. So my suggestion to you is if you want to get connected to somebody, one of those 4 people who reach out to an area, I would even shoot me an email and say, when they are ready, please pass my information on to them and get them to call me.
Right. Or
Yeah.
to offer to you, if they want to connect with us, we can send that information out through our partners meeting list, as well as, of course, through Healthy Aging Alberta. They would be able to help with that too. So when they're ready.
Yeah. So this is what we need to know for them to do their job and do their job well. We need to know what you guys have to offer and where you guys see the need, or where you like, hey, you need to reach out here. We need to know that. Yeah.
Great. Yeah. So let's keep connected about that.
Yeah.
I see Tracy's hand. I'm just going to go to one question in the chat box first. Robin, I feel like your question's been answered with this last discussion. But just the next one is from Gail saying, wondering if 211 data is available for analysis.
Oh, we have for analysis, yes. We do also our own. We have a whole team that we've hired to do analysis of the data. And actually, if you go to the website, you can see some of it.
And if they connected with that data team, because I think folks are looking at for their own communities, if they could pull some of that data so they've got that specific community data, right? That would be,
connect with the data.
Really helpful.
Yeah, connect with the data team. They're awesome. I connect with them all the time. I ask them questions all the time myself too.
Great. And we've shared some things in the chat box, but we'll, put that in our follow-up email with this is the data team and that kind of thing for the folks on the line here. Tracy.
Good morning. Thanks for this, Bobby Joe. Honestly, it's been really helpful. We are on 211, and as the conversation earlier, the FCSS is definitely the catch-all, and over time, especially like coming out of COVID, with Alberta Supports having their doors closed for so long, we were getting phone calls from Alberta Supports and people would say, oh, 211 told us that you would help us do an application. So there was a lot of miscommunication with the FCSSs for sure.
Yes.
And I'm glad to have this email to try to get it sorted out, because we haven't had any luck in the past. We've talked to people and we just haven't got anywhere. So I definitely am going to follow up with that email for sure. But I am on the website right now and just trying to navigate. Just my question is, like, if I just type in Westlock, sorry, I didn't say I'm with Westlock FCSS, will it just bring up a list of services? Because we're obviously with interagency, we can connect with all of our local agencies to say, you need to be on it if you're not, but I'd like to know there. So I'm just struggling with finding how I would
Yeah.
look.
I feel like, I mean, that's kind of, I don't know how much time we have. So you kind of have to put it in by what your need is.
Oh, okay.
Yeah.
Okay. I just assumed I could say Westlock, it would bring up all the services, but it
No.
doesn't function that way. Okay.
Down the line, that is one of our goals, but we're not
Okay.
there yet. But it is
That's
on our big to-do list. Yeah.
Okay. Awesome. Thank you.
Neat. Any other questions here for Bobby Joe? Great discussion. I think the ones that I had have been covered also from other people's questions. I think the data part of it was new information for me, and I think that will be a great resource for people to be able to see, oh, people are calling about this. Maybe we need a education session in our community or something like that to address it on a broader level. So that'll be wonderful to have.
Yeah, and like I said, the database team are really, really open and want to get the feedback about what's incorrect, what's missing, you know, whatever, like, because like I said, they're just playing catch up now from pandemic and wildfire times, right? So
Yeah.
definitely reach out to them.
Thank you. I see Gail there.
Thank you, Bobby Joe, for this presentation. I've really enjoyed it, and for hearing others' questions. I'm an associate professor at the University of Alberta, Faculty of Nursing, and I do research on mentally healthy living. And I'm currently investigating what mentally healthy living structures look like for people at different points in the life course. So I find this conversation and this resource very intriguing. So my curiosities were around learning more about what late midlife adults in particular do to tend to and nurture their own mental health on the ground, at work, looking after family and so forth. I was very keenly interested in your data in that respect, and I have a meeting at 12:30 today to find out some more information about a call from the Canadian Health Research Group in Ottawa about what structures help determine or shape people's health and well-being. And I'm going to be putting in a proposal for that. So understanding, you know, being aware that this data is here is very helpful for me to not reinvent the wheel and to use resource dollars wisely as a form of stewardship. Yeah, I just wanted to say thank you so very much for 211 service, and I would certainly welcome the privilege of connecting with a data team. Thank you.
Great. Thanks, Gail. I'm thinking, Gail, too, would be great for us to connect just about our work that we're doing within our Connecting People and Community initiative also. So might be helpful. Yeah. Oh, you just have your mute on there. There, yeah.
Pardon me. I just gave a presentation about connecting communities yesterday at MacEwan University. I'm hoping to partner with them on some research that pertains to Ukraine health and well-being. So thank you very much, Helen, for that. Let's connect.
Thank you. Great.
And just another quick thing I wanted to mention, under kind of what I overlook, I also we've hired a gender-based violence portfolio lead, and her whole mission in her job is to bolster those kind of resources across the province. She's also new, but I'm really excited about what she can do. And I'm actually right in the middle of hiring, or I'm about to hire an Indigenous relationship portfolio lead, and they're hopefully going to be someone who can go into communities and work with those communities and helping them understand and know about 211 and get the resources they need. So that's also really exciting.
Nice to have those dedicated resources to those areas for sure. Yeah. Great. Okay, Lisa has just put in the chat there that there is an Indigenous line in the
Yeah.
north. So, and you know about that. Okay, that's good. Thank you, Lisa. Any other questions from the group? Okay, well, thanks everybody, and we'll I think move along here. We have another person who is here to present about an opportunity, Deanna Cretu from the Imagine Institute for Learning. And maybe, Deanna, it's maybe easiest for you just to share your slides right now from this screen.
Absolutely, Helen. Happy to do so. Thank you kindly, Bobby Joe. That was great for me to get a refresher. I think I've had a chance to work with 211 or to access 211 when I was working frontline, but it's been a second, so it's always good to get a reminder of what an important and useful resource that is. As Helen mentioned, my name is Deanna Cretu. I hope everyone can see my slides okay?
We are seeing you actually.
Oh,
As opposed to your
interesting.
slides.
Let me try that again then. Just technology won't work with me today. Let's see. Now you can see my slides, okay?
Yes, we can. Yes, thank you.
Beautiful. Thank you for your patience. It's been a second since I've been in Zoom. We use Teams on my end, and I always say technology keeps me humble. You know, whenever we do a little switch, I just don't know what's happening. As Ellen mentioned, my name is Deanna Cretu. I have the pleasure and honor of working with Imagine Institute for Learning, specifically stewarding funding for mental health first aid supporting older adults. So making sure that everyone and anyone across Alberta has the opportunity to take this training. If you don't know about Imagine, I shared a quick link in the chat box just to our page that specifically speaks to the mental health first aid training. But our website, of course, is available to you to peruse for any other training opportunities. We've been around since, I want to say 2001, so over 20 years now, doing training and development across Alberta. I always like to say we do capacity building for humans that work with humans. So if you're a human, there might be something that we do that is of interest. Relationship-based practice is really at the core of what we do, and so is trauma-informed care. We're a trauma-informed organization, so that is really the lens through which we look at the world, and that is how we develop all of our training. Compassion is also at the core of what we do, and we often, one of our flagship training has to do with transforming compassion to action. We speak about vicarious trauma, we speak about compassion fatigue, we do a lot of work around mental health in the workplace, building psychological safety within the workplace, just any training really that we have witnessed or we have heard from folks accessing our training that is needed, we have had the opportunity to develop. All of our training at Imagine is developed in-house by our curriculum developers and facilitated by our senior facilitators and facilitators. And that is really where mental health first aid sort of comes in as like an additional project type of work. Because we've been doing training and development across the province for so many years, we were identified as a good steward for funding related directly to mental health first aid supporting older adults. And we chose to take up the challenge to make sure that everyone across the province has a chance to take this training. As you may know, the Mental Health First Aid Supporting Older Adults training is created by the Mental Health Commission of Canada. So it is not curriculum that we own. It's standardized curriculum provided by the Commission. And we work with facilitators trained by the Commission as well. We're so fortunate actually here in Alberta to have a really, really big pool of mental health first aid supporting older adults facilitators. We're a little bit of a unique case across Alberta, which really means that we can accommodate training dates sort of really quickly and are able to train all across the province. So that is really exciting. As you see on screen, this opportunity, this training specifically is available both online and in person. There's a few key differences between the online delivery and the in-person delivery, and I'll share a little bit about that. And as you also see, we're now in sort of our final year of funding. We're taking this home until March 2025 is when you are able to access this training for free for your communities, for staff, for volunteers. I would say the most likely the intention of the funding is to have those who serve seniors in a formal capacity, in a professional capacity. But here at Imagine, we know that in some of our smaller communities, it might be the community librarian, maybe that has a conversation with the senior, or it might be a postal worker. So I always say if you talk to one older adult once a month, I would like you to take this training so that hopefully that conversation is a little bit more meaningful for this older adult. Just a little bit about some of the objectives of this training. It just like physical health, this is not, you are not in a position to sort of diagnose anything or to sort of prescribe next step. This is really an opportunity to intervene within a crisis context, provide that initial help in dealing with that problem, guiding the senior or caregiver towards appropriate professional help, and then hopefully provide some resources and supports available. Maybe give 2-on-1 a call together and see what is available for folks in terms of support. I won't speak too much about this just because I've already spoken to it, but we really want everyone and anyone. The funding covers this training for any Albertan that is willing and interested in taking this training. So if you know a friend, if you're a caregiver to a loved one or an older adult, please don't hesitate to reach out. We want this to be as accessible and available to everyone as possible. Some of the topics covered within the mental health first aid supporting older adults training, you might be familiar with the mental health first aid standard that the commission also provides. I know they also have a youth variation, and I believe they also have an Indigenous variation. There are for sure some broad themes that are mental health related that you'll, if you've taken some of those other training pieces, you will notice. But this one is very much so meant and targeted to older adults. So you'll notice that we have dementia as one of the topics covered within this. We'll talk about psychosis and psychotic episode, anxiety and trauma related disorders. Some of those pieces that of course might emerge for some of us as we move through life stages, but some of those pieces that will for sure come up in older adulthood as well. Just to speak a little bit to the virtual training. So the virtual training happens over one full day of training. It is a total of 10 hours of training time. So prior to attending the live online training, all participants have to complete a self-paced module, which takes no longer than 2 hours. After they complete that online prerequisite module, they're able to attend the live online training session, which is usually scheduled over 8 hours of training time. And then after they complete that, they receive their certificate directly from the Mental Health Commission of Canada via email. We are able to accommodate a maximum of 15 participants for our virtual sessions. For the in-person training, it is a total of 14 hours of training time, and that does not include lunch and breaks. I always try to sort of make sure that I put an asterisk there and mention it to folks. So that does look like 2 full consecutive days of training. We are able to accommodate 25 participants for the session as a maximum. And of course, participants have to attend both full days of training. We have a little bit of wiggle room from the commission in terms of, for example, we could have day 1 of the training happen on a Tuesday, and then day 2 of the training happen on the following Tuesday the next week. But that is as far as we're really able to stretch, and that does also depend on the availability of our facilitators. As I said, until March 2025 is when you can get this training in your community. I have shared with Helen and some of the Healthy Aging Alberta folks that right now we're really keen to get some sessions going in Southern Alberta. It's been a little bit tougher for us to get into Southern Alberta communities. Not for lack of trying, but we're still at it and we will continue trying. And of course, we're very interested to make sure that our Indigenous Albertans also have access to this. So if you are connected to any Indigenous communities or organizations that you believe would be interested in this, please connect us, as well as any other cultural backgrounds. We've had a chance to sort of work with seniors of Chinese heritage or sort of Asian heritage across the province, but any other cultural background as well. We know that sometimes some of those cultural elements can add a little bit of a layer of stigma or make it a little bit harder for folks to access support. So it's even more important to ensure that this information reaches them. On the screen, you'll see my name and my email. So please feel free to reach out if you have any questions or you're interested in just learning more about this opportunity. We're very, very happy when communities work together to host the session. So if you are already connected with multiple partners that are maybe doing this work, maybe through Healthy Aging Alberta, we really, really love to work together within a community setting to sort of make sure that we not only meet that maximum of 25 participants for in-person sessions, but that everybody knows and has the opportunity to attend if interested. You will see from the link that I sent your way in the chat box, you'll notice that if you scroll down to the end of the page, there's an interest form there. That's another way in which you can connect with us. If you fill that interest form out, you will notice that there's an option to fill it out as an organization or as an individual. If you fill it out as an organization, I will be reaching out to you to sort of connect and hopefully talk about hosting a session. If you fill it out as an individual, you will be added to our individual wait list and you'll receive information about upcoming sessions where spots are available. And I believe that is that. I'll maybe leave it up a little bit more just so folks can get the information they need, but I am more than happy to answer any questions you have.
Thank you, Deanna. We just have some really nice comments within the chat box about people who have taken it or have heard of it, this training, and that it's been really great, and they really recommend it to everyone. So just wondering if there are any questions for Deanna. Okay. Oh, Gail, sorry, I see your hand now. Thanks.
Diana, thank you very much for sharing about this resource. Have you seen different patterns of uptake in training, wants and needs? Like how has that played out for you? Because I'm just imagining the World Mental Health Report and what's been going on post-COVID. So have you seen surges or increases in accessing the training, or?
That's a really interesting question, Gail. I will say part of the reason why we're so fortunate to have so many facilitators in Alberta is because there has been a previous round of funding to cover mental health first aid supporting older adults. I want to say back in 2017. So as a province, we were already poised to do this sort of work. I would say whenever I do connect with organizations, I've connected with over, I want to say 300 organizations so far since we got started in 2022. I would say this is for sure something that is in high demand. A lot of organizations really see the need for this. The training also does provide a little bit of guidance in terms of self-care for caregivers or for those providing supports as well. So I think that is always needed. That being said, I will say that, it took us a little bit to sort of get going. So the demand was a little bit slow to pick up. I think part of the reason for it is because of the time commitment itself to take the training. I can imagine for some of our organizations to have, 25 staff or 15 staff gone for one day or 2 full days of training is quite a strain and can cause some capacity issues. So I think because of that, sometimes it's been a little bit tougher. I know like turnover is also a big thing. So for example, we've had some organizations that we worked with back in 2022 when we got started, and we had trained all of their staff at that point. And now they have come back, with new staff that have joined the organization and wanting to train them as well. As we are headed into our last final year of funding, we are very interested to collect some information around what other training opportunities would be beneficial for those supporting older adults across the province. Some of the things that I've heard informally just in meetings is, a need to cover some of those pieces around vicarious trauma. Some training specifically around loss and grief is something that I've also heard, and maybe a bit more targeted training around sort of self-sustainability and healthy professional boundaries. We often say, as folks working in this space of human services, we are the tools of our trade. So I think folks are really, really interested in some of those the training and capacity building opportunities to really sharpen themselves and sharpen the tool to better care for themselves and others. So I would say we're at peak demand right now. I think because of the limited time offer until March 2025, things are really picking up for us right now. We're seeing a lot more demand and a lot more outreach. Hopefully some of the word of mouth has also traveled by now. So some of the organizations that have taken the training have shared the information with others. So yeah, we're seeing a lot of demand, a lot of interest in other training. I think part of the challenge with the mental health first aid training is that it is standardized curriculum. So for example, unfortunately, it doesn't really speak to the experience of Indigenous sort of seniors and Albertans at all, which is a little bit challenging, especially as we're trying to engage Indigenous communities as well. And then also like just very briefly upon that self-care piece, which I think there's a lot more need for that than we maybe anticipated. So yeah. Hoarding is not a topic that is covered, but here at Imagine, our CEO and founder, Lynn Marie Perron, has actually built a training around hoarding and has taken a certification around hoarding. So that is something that we are able to provide as an organization to really scaffold. And that is also something that is really nice because we are a training organization. You know, all of those missing pieces sometimes like are things that we cover already. So it's been a really nice and organic way for us to sort of share with folks, you know, it might not be covered within the mental health first aid training specifically, but it is something that we're always happy to support with.
Thank you. Any other questions? Pam, did you want any more information about that? Is that good?
Yes,
okay,
please.
thanks. Yeah.
And
Any more
yeah,
questions?
I'll
Yeah.
stop sharing now. I'm going to assume everybody had grabbed my email, but if not, feel free to just send me a quick message and I'll share that your way.
Sure. And we'll share all of that information with our follow-up email to Deanna. So,
Thank
yeah.
you.
Gail.
And just wondering about the training modules. Are these geared toward just like any stakeholder? I'm thinking, for example, educators who could take this kind of training.
So their only module that is involved, like, well, I guess the entirety of the training is structured within modules, but for the in-person, for example, you know, you just go through the content within the 2 days is not necessarily separated per se as modules. I would say the only piece that like is a little bit of a separate thing is the prerequisite module for the online session. The commission says it takes about 2 hours to complete. I will say I've taken it and it took me 1 hour to complete. So there's for sure a little bit of space there built in to accommodate for maybe English as a second language or folks that are maybe very keen and want to click on all the links and do all of the in-depth reading. There's for sure a little bit of room there. And the online module is self-paced. So folks can kind of take it as slow and steady as they need to get that understanding. I would say in terms of the live online training session or the in-person training session, you know, it is a joy to work with the facilitators that we have because they themselves have extensive experience working with older adults. So sometimes even if maybe the content itself doesn't touch upon something, they have that experience and expertise to bring into the mix and speak to certain pieces, which is lovely. We have some facilitators that sort of have maybe another language that they speak. So sometimes when they're working with individuals who also speak that language, they're able to provide a little bit of that support. But aside from that, I would say in terms of accessibility, it is truly meant for either, you know, a volunteer or someone who works with older adults in an informal capacity, as well as those who are maybe working in continuing care or within like a formal senior supports capacity. The one piece of feedback that we have heard is from maybe some of our folks that are within healthcare. So maybe like doctors or nurses or nurse practitioners or those folks that maybe have access like other levels of training as well. We have heard that like, you know, maybe they wished for a little bit more from the training, but as a baseline entry level kind of training, I think it does a really, really good job at bringing everybody kind of up to speed into the same level.
And Diane, if I may indulge you for another brief minute, One of the things I'm noticing as a professor is that mental health needs of students in the classroom are escalating, and I find myself stepping into situations that are a bit of a sticky wicket, and having to perform some first aid interventions that are so acute that it will require two persons and a crisis counselor on the phone as you're walking to a taxi to get live support. So this idea of warm handovers really resonates with me. And one of my wishes is that there's a training module for post-secondary educators who are dealing with this in the classroom every day. And you never know what you might find from a student you learn, immediately after your class that a parent has just committed suicide, or, a friend has been murdered, or someone has experienced physical violence 2 hours before a final exam. This is very disconcerting, and we're dealing with this on the ground, and it is a very sticky wicket. So on my wish list is resources to help with that, to provide some initial urgent stuff. Yeah.
I just want to take a moment to thank you, Gail. I think I'm someone who is very passionate about advocating for young people, and it is very tough out there right now for our young people. So thank you for not just being a professor, but being a human who is able to show up in a human way and care for others. I think that goes a long way. We do have some training around kind of like that trauma-informed de-escalation and trauma-informed sort of support, as well as that like vicarious trauma, because of course, as someone who's intervening, you yourself are taking a little bit or sometimes a lot of that burden on. So we do have some opportunities there. I know this is a provincial context, so I struggle a little bit to share this, but right now in Edmonton, through the Living Hope Initiative, we do have some funding from the City of Edmonton to provide some of our training for free for Edmonton citizens. So if you are located in Edmonton and you'd be interested to see what we are able to provide for free right now in Edmonton, please send me an email and I would be happy to share those opportunities. We're also very excited. We just developed a new training that takes a historical look at mental health and has a little bit more of a human-centered perspective to mental health. I think sometimes we are very quick to sort of jump in that diagnostic space, but we really want to bring the humanity back into the human equation. So that's also a training that I would recommend, that like really helps provide a different perspective around like why that might be and how that happens. We also do have a suite of suicide prevention training. One of the training available for free right now through Living Hope is our QPR suicide intervention course. We also have another course around understanding suicide that really provides that sort of background information behind like why some of these things might be happening for folks and why some of these behaviors might be coming up. So yeah, we're doing our very best. So thank you for you also doing your very best. I hope you're able to access some of the supports that are currently available, and also hope to see you in one of our training rooms soon.
Thank you very much.
Great. Okay, I see one hand up, and then just in the chat there, Pam, I just shared that when it's a legal issue, victim services is a good initial option who can check up and connect to local services. I'll hand it over to you, Erin, and then I think after Erin, we'll just get through our last few resources that we had on our slides there. Go ahead, Erin.
Thank you. Thanks, Diana, for the presentation. Just wondering, are you finding that it's mostly individuals signing up for your courses, or have you been going into, say, some continuing care facilities or healthcare facilities to offer this training?
I would say both. We have a pretty good steady stream of individuals that are just interested in the training. Sometimes they belong to continuing care organizations or healthcare organizations, but it might be those that don't quite have the capacity to host the training for themselves. Either they don't have enough staff to meet those maximum numbers of attendees, or they just might not have the capacity to have lots of staff at once join a training. So our individual wait list is going strong. But we've hosted, I want to say, I don't think we've quite hit the 200 session mark, but we've hosted over for sure 150 sessions so far. And we have been working with a lot of continuing care organizations, also home care organizations sometimes. Yeah, just, and also like FCSS and sort of community-based organizations providing support for seniors. So yeah, I would say it's been a mix of all of those.
Thank you.
Nice. Great. Great. I'm just seeing one message from Mika. With the changes taking place with our healthcare system and what looks to be an increasingly significant backlog in mental health related referrals and accessing counseling, many family, friend caregivers, and their care recipients are experiencing helplessness and hopelessness. Those of us who support them often feel heavy-hearted and our resilience challenged on an ongoing basis as well. Hope your training will receive further funding to help contribute to the health and strength of our community from multiple levels. Thank you so much for what you do. And Sharon was saying, to Pam, Sage Seniors has good hoarding supports also to talk to them. So that's an Edmonton-based organization there. Okay, we'll just quickly get through our last couple of slides. There we go. Just wanted to share about a couple of other resources that had come our way. So there's the Household Food Insecurity Actions in the Community webpage there that you access information on. And resources, infographics, all of those kind of things. If you have questions, please connect with Callie there. And again, all of these resources will be shared in the email afterwards by Kate. And then just about this call for letters of intent. It's a funding opportunity from the Public Health Agency of Canada called Dementia Community Investment. So optimizing health and well-being of people living with dementia and family caregivers, and increased knowledge of dementia and risk factors and protective factors. Quick turnaround for that letter of intent, July 24th there. And I'll just hand over to Kate here about our new series next year for the partners meeting.
Yeah, I won't say very much. It's all right there. I will be sending this new registration link out in the follow-up email, and I'll send a reminder later in the summer in August or so. So as you know, this is the last meeting of the 23-24 partners meeting series. And so there will be a new link coming up in, available right now. You could click on it right once I send out this email. And the new meetings will start on September 24th again. And we've just changed the time a little bit from 9:30 to 10 to 11. So this way it's right on the hour. We'll see if that is helpful to people or not. And that's it. We hope to see you in the fall.
Great. Thanks, Kate. Then I think our last couple of slides are, this is our website and how you can get to it to find out more about our work. And then the Core Alberta group, which is the host of this partners meeting series, and then our contact information. So yeah, you can use any of that information if you're needing to there. Great. Well, thanks, everybody. Thank you for the discussion, the presentations. It's been a great session today. Enjoy your summer, and we will see you again in the fall. Bye-bye.
Thanks, everyone. Bye.